My name is Ethan Kaler. I'm 28 years old from Benton, Kentucky. I have a beautiful wife and a beautiful child, and I almost died from COVID. I didn't believe the coronavirus was real. I thought COVID was something that was made up for political gain. From either side, I got it, and it about took everything from me. I own two small businesses. One of them is a pontoon rental business on Kentucky Lake, and the other one is where we're standing. It's my custom Cerakote gun shop. Paint guns, engrave guns. This is actually a AR for Ducks Limited. We lasered in and custom painted this. Paint cups, I engrave cups. A lot of our customers come from corporations doing Christmas gifts or bachelor parties like this group of cups here. COVID took a toll on me physically, emotionally, financially. I was hospitalized for 17 days, got COVID pneumonia, DVT blood clots in my legs. Then I got regular pneumonia. I went into organ failure for a little bit, and they also had to shove a bunch of tubes in my chest and scrape my lung out. Probably the hardest thing about sitting in the hospital is you see a guy laying in his bed, and then you look out 2 days later and there's a bag being rolled out of his room. And you obviously know what just happened, and you're in the room right next door to him. My parents came in to come see me and pretty much tell me bye. To have that thought that I wasn't going to see my son on his first birthday was pretty scary. The whole experience of having COVID has changed my outlook on life. I don't take for granted the little stuff anymore. I was told by my doctors that if I don't get the vaccine, chance of me passing away from COVID if I get it a second time is very, very likely. So I will be getting vaccinated. If I saved one life by telling the story, then that's worth it to me. And take it from me, I've seen what that virus can do, and I'm getting the vaccine.
Good afternoon, and welcome to the 2021 Howard L. Bost Memorial Public Health Forum, presented by Aetna Better Health of Kentucky. I'm Ben Chandler, President and CEO of the Foundation for a Healthy Kentucky. We're thankful that through technology, we can bring this forum to you virtually, and we look forward, hopefully, to seeing you in person next year. Today and tomorrow, we're focusing in on vaccine policy, myths, messengers, and messages. We've brought together top experts in their fields from across our Commonwealth and the nation. And we're not just talking about COVID-19. We'll also focus on vaccines in general, from measles to polio to a newer kind on the block, chickenpox. The chickenpox vaccine became available in the United States in 1995. That means while most of us here today had the chickenpox as children and remember it, we have young parents now who have never seen the disease and its effects. Symptoms range from an itchy rash and headache to brain swelling and skin scarring. Further, we have med students who've never seen chickenpox and are trained to identify measles, polio, or smallpox. We have generations who have never seen the devastation and lifelong effects of these deadly diseases. No parent wants their children to suffer, but increasing vaccine hesitancy across the board leads to the potential of children getting these infectious diseases. And why? Because parents don't fathom the real risk to kids because they're not getting the whole picture. We have to acknowledge and address valid safety concerns, but we're also dealing with mistrust of government, the healthcare system, and misinformation abounds on social media. A recent Nature study analyzed Facebook interactions and predicts that anti-vaccination views could dominate within a decade. Why? Because unfounded opinions not based on science get more traction, making them more effective in engaging with undecided groups. It's a troubling trend. We believe the issue of declining public confidence in vaccines is a burgeoning crisis. In fact, the WHO calls vaccine hesitancy one of the top 10 threats to global health. That's because dipping below 90% of people vaccinated for certain diseases, below herd immunity, puts us all at risk. It provides a window for outbreaks of these diseases we thought had been eliminated. Think about the measles outbreaks in recent years in places like Kansas City, Austin, Texas, Seattle, Portland, and Phoenix. These were all the result of parents choosing not to vaccinate their children against this highly infectious disease. Here in Kentucky, we're at the risk of unraveling 50 years of vaccine policy that has successfully protected us from devastating diseases with lifelong effects. This trend began before the current pandemic. A 2018 survey from the American Society for Microbiology and Research America showed the percentage of American adults who said it was very important to have their children vaccinated was down 11 points over a decade, and confidence in the system evaluating the safety of vaccines dropped by 8%. That same Americans who strongly believe that they benefited from the development of vaccines over the past 50 years had dropped 16%. We asked Kentuckians in our Vaccines in Kentucky poll if they thought the benefits of vaccines outweighed the potential side effects. 2/3 said the benefits outweighed the risk for adults, and for children, 3/4 said the benefits outweighed the risk. Additionally, 7 in 10 Kentuckians agree strongly or somewhat that all routine vaccinations recommended by the CDC are beneficial. 4 out of 5 Kentuckians agree strongly or somewhat that being vaccinated is important for the health of others in the community. And 90% agree strongly or somewhat that getting vaccinated is a good way to protect them from disease. Still, any decline in these numbers is cause for concern. Decisions made by parents today and actions taken by our legislators today will lead to results that we may not see for years. We cannot take our vaccine policies for granted. History has shown us lapses in protection can cause future pandemics, impacting people's health, our economy, and the future of our civilization. Kentuckians already face real health challenges when it comes to things such as cancer and diabetes. We don't want to go backward by weakening vaccine policies. We can't risk it. So what can be done? Well, that's what we're going to explore over the next 2 days. We have got to increase public trust in vaccines across the board. Looking at COVID-19 immunizations, we can see progress is being made. Our polling showed overall vaccine hesitancy dropped by about 1/3 over the past 6 months. That's good news. Back in February and March, 29% of Kentuckians told us they would probably not or definitely not get the COVID-19 vaccine. And half of them told us they were open to changing their minds with more time and research. In August, that number dropped to 20%. 20% who said they would probably not or definitely not get the COVID vaccine. Today, we'll get a state of vaccines in Kentucky from Public Health Commissioner Dr. Stephen Stack. We'll also take a look at vaccine policies, research, and successes. And tomorrow, we're going to hear from U.S. Health and Human Services Secretary Javier Becerra. Dive in on vaccine messaging and take a closer look at vaccines for children, youth, and adults. Plus, we'll discuss how to improve Kentucky's immunization registry. Now, putting on this Bost Forum is a big task, and we are honored to partner with Aetna Better Health of Kentucky to present it to you. It's my pleasure to introduce to you Paige Mankovich, Chief Operating Officer for Aetna Better Health of Kentucky. She oversees the day-to-day operations of the Medicaid health plan, working across all internal departments at the health plan and national level to develop the best practices in health services and plan operations. Paige also serves as the liaison with the Kentucky Cabinet for Health and Family Services, the Department for Medicaid Services, the Advisory Council for Medical Assistance, the Kentucky Hospital Association, and the Kentucky Chamber of Commerce. She also serves on the Kentucky Chamber of Commerce Foundation Board of Directors and is a member of the Chamber's Recovery Task Force. Paige was born and raised in Madisonville, Kentucky, and she currently lives in Louisville. Will you please welcome at this time, Paige Mankovich.
Thank you. Good afternoon. It is an honor to be at the Bost Forum with you today on behalf of Aetna, and I'm looking forward to learning more about vaccines and their effects in our communities from some of the state's top minds. At Aetna Better Health of Kentucky, we are dedicated to supporting our members on their paths to better health and improving community health outcomes across the state. Over the years, the world has seen that vaccines are a critical component of positive community health outcomes. Devastating diseases of the past, like smallpox and polio, no longer threaten entire communities thanks to vaccine pioneers like Louis Pasteur and Edward Jenner. Vaccines have routinely saved lives and cut medical costs down for communities. They've been a normal part of our lives for decades, but COVID-19 has renewed a sense of purpose behind vaccine distribution, administration, and education. A little more than 100 years after the influenza pandemic of 1918, another pandemic brought our world to a standstill. With incredible speed and efficiency, vaccines for the coronavirus were created. When vaccines became available to the public, Aetna did not waste any time greenlighting a plan to help get as many Kentuckians as possible vaccinated. Aetna was the first MCO in the state to offer member incentives for getting the vaccine, mailing vaccinated members aged 16 and older $100 Visa gift cards following completion of their vaccine dosage. We've recently begun rewarding fully vaccinated members between the ages of 12 and 15 as well. Aetna outreach coordinators also dedicated weeks of outreach to calling Aetna members, speaking with them one-on-one, and encouraging them to get vaccinated. Our top-down efforts, partnering with local businesses and groups to host free vaccine clinics, providing free transportation to and from appointments, scheduling appointments, supporting local events, and more, have made an incredible difference in our vaccination rate. Nearly 50,000 of our vaccine-eligible population have received at least one dose of the COVID-19 vaccination to date, with the numbers continuing to rise each week. We have sent out more than 33,000 gift cards to vaccinated members aged 16 plus and approximately 5,000 gift cards to vaccinated members between the ages of 12 and 15. We've even made the gift card process as easy as possible, using our own team to review the state's weekly vaccination file, along with pharmacy and medical claims data, to identify members eligible for incentive and automatically mailing them the appropriate gift card. Bottom line, we care about each one of our more than 240,000 members across the state. We are committed to being by our members' side every step of the way. We will continue maximizing all of our efforts to increase Kentucky's COVID-19 vaccination rate, addressing vaccine hesitancy among Kentuckians, continuing to work with local healthcare providers, pharmacists, and community partners to find ways to combat misinformation, and encouraging people to get vaccinated by engaging in an open and fact-based dialogue. There's nothing any of us want more than to see our world go back to normal, and COVID-19 vaccines are how we get there. Vaccines are an incredible medical achievement under normal circumstances, and our present day is anything but normal. Even more than this present challenge, it's important to both understand and acknowledge the significance vaccines have on positive health outcomes and savings in our communities. So thank you, each of you, for taking the time to attend this forum. Conversations that will happen within this forum over the next couple of days are so vital to the day at hand. Aetna Better Health of Kentucky is thrilled to be able to participate, and I am looking forward to expanding my understanding of such a critical issue alongside you all. Thank you.